Hey guys, today's video is brought to you courtesy of Rwazi. Rwazi is a data company that aims at providing organizations with fresh on-ground data on products and services from Africa. With this, it gives them an insight to such organizations on what is happening in the market space. And what's up, beautiful people? This is your tooth doctor Maureen Mora here. Welcome back again to my YouTube channel. All we do here is learn and talk matters oral health, and it's simply because I believe everybody is entitled to good oral health status. And guys, thank you so much for always staying tuned to this amazing channel. I mean, I don't know whether I've ever said this before, that my dream one day is to completely bridge the gap between knowledge, awareness, and the desperately needed dental care. So I believe for those of you sharing these videos to your friends, your relatives, with that it makes me to strongly believe that this dream will honestly be valid one day. So thank you so much. Let's keep doing what we do best. Straight onto our video today. I got this question on my Instagram where someone had DM'd me wondering whether sensitive reliever's toothpaste actually work. And before I answer that, I honestly want to appreciate such questions. So if you have any other question in regards to oral health, feel free to get in touch with me through my Facebook page, The Tooth Doctor, or my Instagram at Maureen Mora, or even in the YouTube comment section. And I promise I will try my level best and answer all your concerns. So on to our question of the day. Do sensitive toothpaste actually work? Let me answer this question by first stating that teeth or tooth sensitivity is a problem that cuts into our daily lives, making eating or even drinking anything quite difficult. So whether or not sensitivity reliever toothpaste work or not, my answer is yes. Most sensitivity relievers toothpaste actually work, especially if you are experiencing sensitivity to cold foods and drinks. And by drinks, simaanishi pombe peke yake, inaweza kuwa cold water, ama ice, iced latte, ice cream, name them. However, if you are experiencing sensitivity to hot foods and drinks, then that is different. What it basically means is that you probably has a cavity or there is a damaged nerve inside your tooth, and that means you really need to visit your dentist as soon as you can. Also guys, another key thing I want us to note is that regardless of the brand you decide to use, toothpaste in general are mostly the same because of the ingredients that help protect our teeth and remove plaque as well. And I guess this probably explains why most people say that some sensitivity relievers toothpaste actually don't work. I want to categorically state that the difference in ingredients is usually very small, but can make a big difference on how the toothpaste helps you manage your oral health problems. So for the cases of sensitivity relievers toothpaste, the difference they have in relation to the regular toothpaste is that they have an extra additive known as potassium nitrate, which helps desensitize, or in other words, to protect the layer that is more sensitive, or rather that part of your tooth that is more sensitive, which is the dentine. The dentine is this layer here, which is beneath your enamel. And this exposure usually happens when the enamel wears away. So the next time guys you are purchasing your sensitivity relievers toothpaste, number one, ensure it is KEBS certified. With that utajua ni legit. Number two, make sure it contains potassium nitrate and fluoride, of course, to help strengthen your tooth. I also want to say that most patients, when using the sensitivity relievers toothpaste, one expect instant results, but on the contrary, most of them the effects usually takes place within 1 to 2 weeks. Kama una brush kawaida, like you brush in the morning and in the evening, with the sensitivity relievers toothpaste. However, I will want to give you a tip that for more effective results, whenever you are using your sensitivity relievers toothpaste, brush with your brush visually as usual, spit the excess, but do not rinse your mouth for at least 30 minutes. Alternatively, you can brush kawaida. Take a little bit of your toothpaste with your finger, and please ensure your hands are clean enough. So you take a little bit of the sensitivity relievers toothpaste with your finger, apply it on the tooth or teeth that are more sensitive, and again, let it sit there for like 30 minutes before you rinse your mouth. With that, unapatia those potassium nitrates to get into those channels zenye zina emit the sensitivity. I hope you've gotten that point well. So for effective results, after brushing your teeth, do not rinse. Spit the excess and wait for at least 30 minutes before you can rinse. Alternatively, take a little bit of the toothpaste with your finger, apply it on the tooth or teeth that you are feeling more sensitive, let it sit there for 30 minutes, then you can rinse your mouth. As I wind up, I have two disclaimers. Number one, sensitive relievers toothpaste does not take care of other issues like dental pain, which happens maybe if you have a cracked tooth or a decayed tooth, which will be painful regardless of which toothpaste you are using. Number two, sensitive relievers toothpaste do not worsen the tooth. On the contrary, using abrasive or very harsh toothpaste, for instance, the whitening toothpaste, runs the risk of making your enamel thinner, and that new abrasion sasa, once the enamel is worn out, it becomes more sensitive. So for sensitivity relievers toothpaste, they don't worsen your tooth. But tukitumia kama hizi tooth whitening toothpaste ama whitening agents, that can predispose your tooth to sensitivity because the enamel has become more thinner, subjecting the dentin to more sensitivity. So guys, I hope I really answered the question well. Thank you so much for always staying tuned to my channel. Until next time, have a good one.